The prostate, what it does, it makes the fluid for ejaculation. So if somebody's done having kids, they really don't need a prostate. A lot of people think that it's related to erections, but the prostate doesn't have anything to do with erection. It's got to do with ejaculation, which is different from having an erection. But people that don't have a prostate or they have a procedure on their prostate, they can have an erection and they can have an orgasm, but they might not be able to have an ejaculation. Now, why is the prostate so important when we're talking about urination? If the prostate is something that's got to do with ejaculation, that's like the sexual system, but why does it have anything to do with the urinary system? Well, it's because as men, the same tube that has urine going through it, that same tube also has the sperm going through it when we're trying to have babies. Now, because of that, the prostate happens to be located right at the base of the bladder. The reason why that's important is because as the prostate gets enlarged, that enlargement of the prostate starts pinching the tube where the urination is supposed to go. And because it's putting the pressure on the urethra, it closes off the urethra, and then the urine can't go through anymore, and people can't pee. In the beginning, they can pee, but they start having urinary symptoms like frequency, urgency, getting up in the middle of the night to go to the bathroom. In the morning, the flow doesn't flow as well, and those small little symptoms, they start getting worse and worse, and eventually, people end up not being able to pee at all, and they can go like 2-3 days without peeing because the urine is getting stored in the bladder. The bladder starts getting stretched out because that urine is not coming out, and eventually they go to the emergency room and they have to have a catheter in order to empty the bladder.